Well, a very good morning, everyone. My name is Mark Boyle, and welcome to this Maynooth University Research Week. I'd like to thank the Research Office, Research Director in particular, for the opportunity of presenting this morning, and to the Maynooth University Social Sciences Institute, particularly Anne Hamilton Black, who has prepared and advertised and marketed this morning's seminar. So thank you to all of the above. So we have only an hour today, so I promise to keep it to time. And what I want to do is to ask a provocative question, I know, but nonetheless a question that I think merits some scrutiny this morning. And this is, has Ireland failed the COVID-19 test? Now, of course, this is a provocation more than an assertion, but let's explore this question in a little bit more detail. It seems to be that there is an emerging narrative as all countries come to the end of the pandemic, hopefully, and as the vaccine starts to regularise normal everyday life. Countries are taking stock of their experiences of COVID-19. They are reflecting on what they've done well, what they've not done so well on, and how they've performed relative to their peers. And I think there's a prevailing and emerging narrative in Ireland that a public inquiry is perhaps not necessary, and that there will be some review, some post-mortem, but not the full-blown public inquiry. And there is an emerging narrative that for sure we have made mistakes and have lessons to learn, and everyone acknowledges and admits this. There were no playbook for COVID-19. We had to deal with things as they arose, and of course that was going to inevitably lead to some mistakes. But I think there's then a kind of consensus emerging that we've done reasonably well. We have at least scraped a pass, so we've not failed the COVID-19 test. Maybe not top of the class, but we are certainly not the worst. And we've done better than others. And one that I particularly think is true, but also problematic. We've done much better than the United Kingdom. Well, that's for sure true, but perhaps the United Kingdom is not the benchmark that we need to be benching ourselves or assessing ourselves against. So what I want to do with a view of suggesting that more significant and serious post-mortem needs to take place into Ireland's experience of COVID-19, and we need to really place under scrutiny what's been happening in the last couple of years if we're going to build back better or emerge stronger, if we're going to fall forward to prepare ourselves to be more resilient in the face of COVID-20, COVID-21, which will inevitably arise. I think we do need to, in a much more studious and a much more serious and sober way, have a mature discussion about our experiences of COVID-19 and what really we need to do in response. So I want to ask essentially three questions. One about calibration. We are in the mid-table is the narrative that's emerging, but in what league are we the mid-table? Causes, I want to ask if we are seeing the trees or the forests. I notice regularly Infact and the government coming under critique for their approaches to COVID-19. So I want to ask, is that really the focus? What do we miss if we have a focus on COVID-19 government responses only? What are we not looking at if we are preoccupied with the efficacy of government responses? And finally, in terms of cures, I want to look at the question of what we need to fix. Of course, the Build Back Better idea is a much abused idea, and you can't really share that idea unless you're able to articulate clearly what Build Back Better actually means. What do we really need to fix? What does good look like? And what changes do we need to introduce in order to meaningfully build our resilience in the face of future emerging and re-emerging infectious disease? So let's start with the calibration question. Mid-table, but in what league? Well, of course, we encounter here immediately the data problems of looking at Ireland in a global comparative context. The data collection issues around cases in particular, but also in deaths, are so severe that some people have abandoned altogether the possibility of comparing and benchmarking their country to any global standard. There's just inaccuracies in data collection, there's inadequacies in data collection, and of course there's a politicization of data collection that sees some countries declare much lower COVID-19 rates than perhaps one could reasonably expect. But I think we have to persevere with the data that we do have available. Johns Hopkins University data represented here in part through the Our World in Data website, a phenomenal resource to look at Ireland in a global context. And what I think is that since the vaccine, of course, things have changed, and we have tried to invent ourselves using technology, invent ourselves out of trouble. I think they must be commended for the way in which we've executed the vaccine rollout program. But in many ways, if we rely on technology to bail us out of a pandemic, we're not really getting to the nub of the issue. So I've confined analysis here to March 11, 2020 to March the 11th, 2021, the period when the first death in Ireland occurred, and then a calendar year to March the 11th, 2021. This is a period when the vaccine starts to gain some traction. So let's just confine ourselves to this and take the data that we do have with all the caveats of the quality of that data. Well, you can see here Ireland in a global regional context here, and South America, the European Union, North America, all are high. Note North America and the European Union in particular here. I want to draw attention to that later, but Ireland is mid-table. But look at Africa, Asia, Oceania, the daily COVID cases per capita shown here. It's clear that other continents are doing much better now. This is just a data issue. Is there anything more to be said? Does this tell us anything meaningful about Africa, Asia, and Oceania's experience of COVID-19? Notice also that the twin peaks of spring of 2020 and also the winter of 2020-2021, we suffered world-class, unfortunately, peaks in COVID-19 outbreaks. This second wave, actually, in the late summer, the fall of 2020, we do relatively well, and we managed to suppress that second wave, but only to yield then to a very vicious, as we know, third wave over that period. Now this looks at the cumulative confirmed deaths per 1 million, again in global regional context. And we see again Ireland distinguishes itself in the North American European context. It performs better in terms of cumulative deaths per million, but in terms of the continents of Asia, Oceania, and Africa, we are still not doing well at all. Now, is this just a data issue? Is there nothing more to this story than differential data? Well, I don't know. We have to look at this question. I've confined analysis to deaths. I think that deaths data is more valid than cases data. All countries, of course, have to certify death certificates. There is huge problems in the standardization of that certification, even although all countries more or less sign up to the international classification of disease. But nonetheless, in the context of a great awareness of COVID and World Health Organization mandates and so on, we have reason to think that deaths might be recorded a little bit more systematically. And also, is this to say that all the countries in Asia, Africa, and Oceania have inadequate data That's a very Eurocentric idea of the capacity and quality of data collection in Global South countries in particular. So we need to be very careful in just writing this off to be nothing more than an artifact of flawed data. And it's clear that there's something going on that is positioning Ireland as performing much worse in the global league table than perhaps in other league tables. Now, this is Ireland in March the 11th, 2021, the top 25 countries in the world with cumulative deaths per million. And we see there are countries a lot worse, Peru, for sure, not doing well. Ireland, about 25th in the world in that period. So we're not the worst for sure, but you know, the 200 countries in the world, we're still 25th. So there's 175 countries doing better than us, and we need to think and reflect upon that league table. Notice here, however, that 18 of the 25 top countries a year into the pandemic were OECD countries, Global North countries, and 15 of the 25 were European Union countries. Now, this is very important because either all the OECD countries and the European Union countries are reporting the data accurately and everyone else is not, or either every government in or the majority of governments in the OECD world, and 15 of 25 governments in the of 28 governments in the European Union have performed very poorly. Governments have become universally incompetent overnight. Either that's taking place, or there must be something structural going on about the OECD world, about liberal advanced capitalist democracy. And is this flushing out some of the structural weaknesses that exist within what I would regard to be a generation of 40 years of neoliberal restructuring? So that is a question I think I want to come back to. This is Ireland relative to the top 25 countries by GDP per capita. And again, mid-table, but you see many countries in terms of the top 25 richest countries in the world doing better than Ireland, some doing much better, Japan, Australia, Brunei, Singapore. Japan, of course, has the oldest age structure of any population in the world, and yet it's doing better than Ireland. Reflecting upon age, this is Ireland relative to countries with similar percentage of population greater than 70 years of age. This is countries whose demographic structure has 7 to 10% of the population age 70 or above. And we're coming in at this mid-table position, but you can see that there are many other countries with similar age profiles to us who have come out of the pandemic with better cumulative death rates per million. This is Ireland relative to the top 30 by the United Nations Human Development Index. And again, they're mid-table comes out, but recall, the richer global north countries haven't been doing well. So we are mid-table in a not very promising table in the first instance. And there are many countries that have done better than us with similar levels of human development. We are, of course, the third top country in the HDI. So we are amongst the most developed of all of the countries of the world, and yet become only mid-table. Relative to the bottom 30, well, this is where data, you might think that this data analysis is essentially flawed to the point of irrelevance. But if one compares Ireland to the countries that are the most impoverished, the most underdeveloped in the world, the bottom 30, we can see that we do much, much worse. Is this simply to do with flawed data collection in the Global South? I would question whether it is universally that. I accept that. I think that must be a significant factor, but nonetheless, this is at least cause for us to reflect upon why Ireland and why the advanced OECD world has experienced COVID-19 in such a devastating way relative to other parts of the world. If there's anything of value in this data, it leads us to wonder why, when at the start of the pandemic, we all feared for the global south, we feared for the informal housing, the 2 billion people living in the slums of the global south, we feared that the disease would rip through those communities. Why is it that it is the advanced OECD world that has come off more harmed by an airborne infectious disease? That is a question that we may ask if there is any value to the data here. Now, I've included this slide here. I think this is the final one. UK relative to the top 20 countries in the world by share of positive tests. And I took the share of positive tests at December the 1st, 2020, enough time where people had their testing regimes in place. A positive test suggests the number of people being tested that comes up with a positive result. It reflects the scale of testing, and it also reflects the efficacy of testing. Anything under 5% is regarded by the World Health Organization as a good positivity rate. Anything above 5% begins to become more problematic. Anything above 5% is liable to be many more cases than we are picking up because our testing regime isn't as comprehensive or as intense enough. Countries with under 5% in terms of their testing are countries that are obviously picking up most of the cases and deaths. And I'm using this as a proxy for data quality. There is no metric to see which countries have the best data, which countries have the least accurate data, but positivity rates give us some indication of this. So these are all countries where I would expect there to be reasonably solid data on death rates that we can trust, because positivity rates are so low. And you can see Ireland is amongst them. Our testing regime has been positive, productive, but you can also see that we are top of this particular table, that when we look at other countries that have tested as comprehensively as us, there are many countries that are doing significantly better. So this raises the question of what table we are judging ourselves against, and if a public inquiry needs to recognise that our registers aren't other advanced capitalist countries, because they are at least based on this data at the top of the table. We're comparing ourselves to the poorest performers, and that when we put ourselves in global context, the outcomes we've secured are particularly problematic. They're certainly higher than one might have expected. So is there a particular issue with Ireland? Is there a particular issue with the OECD world? Is there a particular COVID-19 geography that needs to be explained? And if we ignore Ireland's place within that geography and only benchmark our progress, our success, our failures against those countries that are geographically proximate and politically and ideologically similar to us, well, we're going to end up in a place where we perhaps don't take seriously enough the extent to which COVID-19 has harmed and impaired our society. So what I'm suggesting here is that I do think there's a need for a public inquiry. I do think there's a need for a post-mortem of real consequence. And I think the narrative that we've done okay, not done the best, but not done the worst, and certainly we've done better than the United Kingdom. We need to be very careful with the way we handle this narrative. I think we have managed our way through the crisis reasonably well, but nonetheless, we have to face up to the fact that our country and other similar OECD countries have had a very damaging experience of COVID-19. And we need to think about if that is just an artifact of data or if this is telling us something deeper. Now, let's look at causes then. So, are we seeing the trees for the forest? Now, I recognise there's a lot of critique of the Irish government's response, a lot of plaudits too. We've done a lot well, particularly in my view, around being strong on public health relative to pressures of reopening the economy. And we've done very well in the rollout of the vaccine subsequently. The adherence of the population to social distancing measures and so on has been relatively good. So there's much to commend ourselves. There's also much that we need to learn from why we had those two peaks that were world class. Were we too hasty in opening up for Christmas time last year? Did we leave it too late to have masks and introduce social distancing? Were we able to shut the borders more effectively and earlier? These are all questions that I think have to be asked. But my own thoughts are that if one places Ireland in the structural context of the performance of the OECD world more generally, we can see that there's a bigger story here, and focus only on government performance and the efficacy of government accomplishments is, I think, to miss the point. Amaryta Sen once said, establishing causality matters. Remember, when it comes to people living in precarity and poverty, a misconceived theory can kill. And we risk in our popular pet theories, explanations as to why we think Ireland has done well and not well on COVID-19, we risk settling on an explanation that kills, literally, because it doesn't prepare us properly for COVID-20 and COVID-21. So we need to get the explanation right. We need to get to the bottom of our encounters. Now, to do this, I've conducted a piece of research funded by the University of Liverpool, and this research draws upon hazards studies, a very fine tradition of study within the human geography tradition. And it tries to look at the risk of being harmed by a natural event. Of course, the idea is that there is no such a thing as a natural disaster. It is only society that translates hazards into disasters and disasters then into catastrophes. So the risk of being harmed by a hazard event equals what might be regarded as proximate determinants or immediate determinants, the triggers that can make or break COVID numbers in any country at any given time. These are the immediate causal factors, but those causal factors work in union with fundamental conditions. The choice architecture that is open to those who have to make decisions around the proximate determinants is constrained by the framing of the prevailing political, economic, social conditions. So we need to understand both in tandem. And if we then break down the formula R equals proximate determinants in union with fundamental conditions and look at the proximate determinants in a little bit more detail, I've broken these down using the hazards literature into exposure. So exposure to particular geographical viral loads, vulnerability, which are further broken down into how immunocompromised our bodies are in the global north, through global north disease, for example, our susceptibility, our socioeconomic underlying vulnerabilities, and their preparedness, whether we have prepared properly for the pandemic, an airborne infectious disease event. And then, of course, finally, we do have to look at response. It's then how we dealt with it once it did arrive. That is the final proximate determinant. So proximate determinants equals exposure times vulnerability, which vulnerability is made up of immunocompromisation, susceptibility, and preparedness times response. And it's the combination of these factors, the proximate and the fundamental determinants, and then breaking down the proximate determinants into further subtypes. That is the analytical approach, which I've tried to use to get at some of the causal variables. Now, I've taken a very particular approach. The data is limited. I've trawled data sets, settled on 66 data sets around the world, measuring each of these things. but we've trawled data to try to get a handle on countries' performance on each of these different variables. And you'll see that I've created 24 conjectures. It's very Popperian in its approach. Simply, we don't have enough data, and it will be some time, a huge scientific effort to try to feel our way towards differentiating some causal factors as being more important than others. But nonetheless, to begin our journey into explanation, I set up some conjectures, and then in Popperian fashion, I went about trying to refute those conjectures, trying to find evidence that they simply are solid explanations, and those that remain fireproof to those refutations, then the last ones standing are the ones that I've taken to be potential candidates to be explanations for the OECD world, and particularly Ireland's performance in relation to COVID-19. So you see, under exposure, under vulnerability, under response, and then under vulnerability, I've broken it down into immunocompromisation, susceptibility, and preparedness. You see the range of different factors that I have identified. These are all the proximate determinants, from global connectivity all the way down to aging profile structures, comorbidities, whether there's TB, vaccine, the BCG, controversial thesis that populations who have previously been vaccinated with the BCG have performed better than those that have not. And then other sets of susceptibility factors, the political system, trust in government, centralized and federalized systems, social capital, social cohesion, social solidarity, and all the way down then to preparedness, the strength of the healthcare system, the capacity of the healthcare system to respond to pandemics, and so on. And then finally down to government responses, where we've looked at government public health interventions, government furlough schemes, and so on, and then long-term care homes and participation in global institutions. So we've looked at a whole variety of different explanations, and through this conjectures and refutations approach, we'll try to think carefully about which remain candidates after careful scrutiny. Now, what we've also done, and this is the key important point, I think, is we've tried to locate the calibration of the proximate determinants, why the proximate determinants combine in certain ways in certain countries at certain times. We've tried to contextualize the calibration of those proximate determinants, what I've called the choice architecture that has been open to governments by rooting the OECD world, and in particular some countries in the OECD world, as having fundamental conditions shaped by the legacies and the logics of neoliberal capitalism. Now, we know in Ireland, certainly from the 1990s onwards, we have operated a small, liberalised, open, globalised economy. And this very neoliberalised, this competitive, this lean and mean, aggressive, the best small country in the world to do business in, has created legacies, some good, some bad. Now, more broadly, beyond Ireland, the neoliberal legacies include major denundations. Neoliberalism has denuded states, who in their denuded state are slow and responsive in their responsibilities to protect the well-being of citizens. It's denuded economies, less resilient to disruptive shocks and less dynamic in the wake of crisis. It's denuded communities. Inequalities have metastasized to the extent that social cohesion has broken down. This is more broadly, I'm not entirely sure this is true in Ireland. And then denuded democracies, characterized by serious dislocation between representative democracy and popular sovereignty, a loss of trust in the political system by the general population. And we know in Ireland's case, the rise of Sinn Féin and the comparative problems of Fine Gael and Fianna Fáil are indicative of an earthquake shift in Irish politics in response to these underlying political and economic forces that have been at play in Ireland since the Celtic Tiger, or at least since the Celtic Tiger. So we would argue that you cannot understand how Ireland performs on the proximate determinants without rooting those proximate determinants within the choice architecture that has been left as a legacy of 30 or 40 years of neoliberalism in Ireland. Ireland's performance has been 40 years in the making, not simply a year or two in the making with the establishment of Infact and so on. And then we have the logics of neoliberalism. It's not just the inherited legacies, it's neoliberalism as it's had an impact in framing the choice architecture, the range of possibilities that are imagined by governments to intervene. And we know that Asian countries in particular have enjoyed a much greater social license to be much more interventionist, and we are through freedom debates around liberal freedom, around what the state should and should not be able to do about the protection of freedoms versus the protection of health. We have got caught up in a very significant debate, and freedom, in fact, has been captured by the neoliberal ideology, the neoliberal legacy, and we have to understand that there are multiple understandings of freedom within liberal capitalist democracy. The Republican tradition, for example, which holds that the state should actively intervene, that freedom is the outcome in many ways of an active state rather than a state getting out of people's business. Why is it that Infact have had such kickback? This has always interested me. It's not judging whether or not the advice coming is too severe or too constraining. Lots of debates that Infact I think miss the point. The real interesting thing to me is why there is a debate at all about some of the Infact's interventions. Now I know we've got to balance the economy and freedom and public health, but relative to other countries, some of the recommendations of Infact are very modest, and yet they attract significant critique. And I think this is because we live in a public sphere where liberal freedoms and the role of the state in everyday life, the rights of the state to constrain liberal freedoms. These are important debates, I know, but nonetheless, they're debates that have played out in the OECD world in ways that have tied both hands behind the government's backs relative to, say, Asian countries who have enjoyed a much greater social license to implement lockdowns and social distancing and so on. So, to our final point, well, I'm not going to be tricked into providing cures when we're only beginning the journey through understanding causes. But I do want to ask the question that a public inquiry is needed, because I don't think we are asking seriously enough what we do really need to fix here. What really is going on here? What is it that we have to try to repair? And the mantra of Build Back Better, rebuild, reimagine, reconstruct, failing forward, emerging stronger, these are all words that are just simply semantics unless they are given serious substantive content. Either we really do want to build back and really do want to prepare ourselves to be more resilient in the face of COVID 2021, or we just want to move on from this, have the cornucopian cure of the vaccine, get ourselves a technical fix that invents ourselves out of trouble, and then we don't really have to deal with the underlying issues that the vaccine has surfaced or flushed out. So I think this question is a question that needs answered seriously. Now, as I said, this will be many, probably decades of scientific inquiry before we will properly understand through a whole multidisciplinary team of experts what factors shaped COVID-19's global geographies in 2020, 2021. Nonetheless, I have identified some of the issues that, at least from the conjectures and refutations analysis, seem important. The need to establish mechanisms to break connections between globalized and localized flows of people and goods and capital seems to be very important. Ireland's position in the global economy and the flows that have washed through Ireland, Ireland's connectivity, even though it was an island economy, its weatheredness and a dense matrix of connectivity to the rest of the world is undoubtedly a significant factor in increasing its exposure, the geographical viral load that's landed on the island. We need to fortify those placed in harm's way disproportionately due to prior underlying health. It's very surprising global analysis here, which suggests that some of the causal comorbidities that are often cited perhaps cannot explain clearly global variation. So, but we definitely notice that respiratory diseases, countries with underlying respiratory diseases, and countries in particular that suffer from global north disease related to obesity is a significant underlying factor. But heart disease, asthma, the evidence globally isn't as strong. Susceptibility, fortify the resilience of those placed in harm's way due to prior underlying social structural damage. And here, it seems that poverty alone and inequality alone isn't necessarily, quite surprisingly, a driver that can explain COVID-19's global geographies. This was a pet theory of mine before I started, but in fact, it is trust in the government, it is social cohesion, it's community support, it's a sense of a glue to society that seems to make most of the difference rather than absolute measures of poverty and inequality. Preparation, well, it is the case that Western healthcare systems have been geared up for degenerative disease and have made an epidemiological transition. And although we've got formidable expertise on infectious disease, our systems simply were not set up to deal with a pandemic. African governments, perhaps West African governments with recent experience of Ebola or some of the Asian experiences of MERS and SARS, they were much better primed and much more able to handle and to jump into action quickly. And finally, of course, this is why I think we do need a public inquiry, there have been mistakes that the government have made, and we do need to look at those. My concern is that we focus only on those and we only see the trees and not the forest. And finally, I think that these approximate determinants, you can go so far to recalibrate them, but for an enduring, sustained building back better that is going to calibrate those proximate determinants so that they are disposed, they have a proclivity to protect us and to build our resilience. I think we're going to really need to look much more deeply at neoliberalism, about liberal market economies, about the operation of democracy. And we probably need to think seriously about a new social compact for pandemic management, for sure. How can the Irish government secure a social license necessary to make the interventions it needs to effectively control future pandemic disease, so we don't have the repeated controversies over Infact and other government responses. It enjoys a social license. And finally, more broadly, I think we do need changes in Irish society. It's quite obvious, isn't it, that the only way to have an enduring Build Back Better is to realise that if there is anything in the story that OECD countries are coming off poorly, then we need to think carefully about whether that model has a number of underlying illness, and we know it has, through boom-bust economies, through global climate, ecological crisis, through mental health, tsunami. The West has a number of fundamental challenges, and COVID-19 arguably has simply flushed out flaws that were dormant or only manifesting themselves superficially in the West. So I'll conclude with this quote from Arundhati Roy in the New York Times Our minds are still racing back and forth, longing for a return to normality, trying to stitch our future to our past and refusing to acknowledge the rupture. But the rupture exists, and in the midst of this terrible despair, it offers us a chance to rethink the doomsday machine we have built for ourselves. Nothing could be worse than a return to normality. Historically, pandemics have forced humans to break with the past and imagine their world anew. This one is no different. It is a portal, a gateway between one world and the next. If we are to build back better, we need to build back better. Okay, I'm going to stop there. We have a little bit of time for questions. So I don't know if Anne, who's technical genius, can see questions in the chat or not just yet. So yeah, John, please come on if you can. It's probably a bit better just doing it online, but if you want to type it in, that's fine too. Is John able to come on, Anne?
Thanks, Mark. Thank you very much indeed for a really stimulating paper. Just a couple of points. First, on the relative responsibility of neoliberalism in respect of the OECD countries especially, couldn't it be argued that COVID has actually seen the return of the state in very significant ways? And in ways actually that were quite unimaginable even a decade ago. You could do the contrast, for example, with the Eurozone crisis, which back in 2011 was still raging. And the only response deemed acceptable by the authorities in Europe seemed to be austerity, putting all of the burden on individual states and on societies. So how does your analysis incorporate the return of the state in so many extraordinary ways as a response to the crisis? And secondly, in respect of Ireland, just in respect of the time frame, is it a little selective to kind of conclude the analysis in March of 2021 when actually the pandemic has continued to rage? Not just around the world, India spectacularly at that time and subsequently, but also even in Europe, we are seeing an extraordinary resurgence in infection in Eastern Europe in particular in recent weeks. So if we're to sort of come all the way up to October 2021 and look at the crisis in totality, don't we get a sort of fairer image of how Ireland has managed? And finally on that, isn't it the case that if you look at the total number of deaths in Ireland, the authorities have probably overstated them because they are counting all possible cases in addition to probable cases? And if we look at excess deaths as perhaps a better indicator, we can see that the number of excess deaths is quite a bit below the level of COVID-described death. So perhaps you could just deal with those 2 points. But thank you for a hugely stimulating paper.
Thanks, John. Great questions and developed, very well developed. The question of the bouncing into post-neoliberal, almost Keynesian stimulus model is one I think that is worthy of us noting. It's unimaginable, as you say, in the context of neoliberalism, that we would have such a degree of state intervention. But what is interesting is the differential geographies of the acceptance and the tolerance and the electoral support for that kind of intervention. You already see it in other parts of the world. It's, we can't keep doing this forever. It's madness having people on PUP, and people are drawing down PUP wrongly, and we should be getting them off because there's shortages in the economy of skilled workers and so on, all the way through to digital test, track and trace measures. We know that there have been countries that have done this far better than we. Our sign-up rates are worries and concerns around government intrusion into big data, surveillance capitalism. So I think the interesting thing is that there have been this rollout of necessity. I think that neoliberalism already in the run-up to the pandemic was in deep trouble. I think OECD and Western countries were in deep trouble, and we saw the populist rises around the world as a reflection of a revolt of the disenfranchised from that system. And I think it was simply intolerable for the elite within the West to allow another disaster only a decade before the previous one, where the poorest in society were left to high and dry. So I don't think there was anything else they could have done, bar have intervened heavily. But I think the pushback that they've had in so doing, and the geographical variations in that pushback is something that points to a very challenging question about the status of freedom and the role of the state as still being a deeply controversial question in liberal advanced societies. Now, it may be, I do think this is a hinge point in history, just like the 1970s shift from Fordist Keynesian to a neoliberal world bequeathed a seismic jolt in political ideology, economic ideology. I do think we another moment in history where neoliberalism has exhausted its consent, and certainly the efficacy of neoliberalism is beginning to reveal itself to be very poor. So it could be that we at the precipice of a new state social democratic experiment where state intervention that is in many ways built on the experimental methods of the past year, 2 years, is mainstreamed more. But I think that, of course, is a political struggle that remains to unfold. On the second question of the data being analysed only for the first calendar year, I think that is an appropriate question to ask, because certainly the Eastern European countries have performed much worse in the second year than the first year of the pandemic. It's quite surprising. There's some emerging geographies. Latin America, South America hadn't done particularly well the first year, but certainly towards the end of the first year into the second year, they started becoming a class in their own, at the worst performers. So we would have a slightly different analysis, I think, if we extended the story out. India, I don't think we would have had a different analysis of India. Has got worse, and there have been certainly moments where it's fine, but India in general has performed much better than Ireland, and even in areas where there have been World Health Organization detailed studies of slums. The Dharavi slum in Mumbai, for example, has been heavily studied by the World Health Organization, so the data is reliable, and it's an insignificant number of cases relative to Ireland. India's large population means an outbreak in India is diluted in many ways. I stop there because I do think that the vaccine has changed everything. So we need to be careful not to skew our understanding of the performance of the West by accepting that we've managed to innovate ourselves out of trouble to some extent. But can you imagine what would have happened if we had not fast-tracked the vaccine? It would have revealed the very deep problems that we have in the West, much more so. So I think going back and asking, okay, well, before we had this get-out clause, how were we doing relative to the rest of the world? I think there's something in that, albeit that the caveat, of course, is that it doesn't tell the full story of the whole pandemic. Okay, I think we've got a couple of more questions. Thanks, John. I don't see the questions here, so. Okay, let me just see. Sean, hi, and Joe and Cahill, good to see you. Great questions. They're long questions. I'm not sure if I'll do them justice. Have you seen anything on comparative social structural aspects of vulnerability? The obvious is Ireland's younger population, yeah, but also aspects of multi-generational households, This is interesting, this question of vulnerability being socially produced rather than being a function of exposure. Different groups are exposed to the same viral load, but have different experiences of it. And I do see age convened as a factor, and do see poverty. The social housing estates of the north of England, where population density, household density is higher, has often been attributed as a factor. But I think when you scrutinise that, we at the very least need to think carefully about those social producers of vulnerability, because it's not at all obvious that those are driving things. Japan has the oldest age structure in the world, and it's done relatively well. Mexico has virtually the youngest age structure in the world, has done comparatively really poorly. So age structure alone, I don't think is as obvious an explanation as it might be. Also, looking at this study in Dharavi, household density in Dharavi, 8 people to a 350 square feet house, as opposed to 2 people to 1,500 square foot house. 60 toilets for every resident, 4 toilets in every house, 3 toilets in every house. And yet Dharavi, just through careful public health consciousness and communication, participation, and trust, community trust and working with authorities, has managed to escape the worst of it. So we need to think about inequality and poverty in careful ways. To me, it is about social cohesion, it's about trust in government. I think that's really key. And I think social production of vulnerability pivots on global north disease. I think that is the obesity in particular is heavily correlated. I think that health inequalities, I think, play a significant role. Thanks, Sean. A poor effort to answer a great question. Any thoughts on how older people have been affected during COVID crisis in Ireland? Yes, George mentioned this at the start. Obviously, the data for long-term care homes was very poor for Ireland as it was elsewhere. It was worse in other places, in Canada, for example, but we done very poorly in protecting the elderly in terms of long-term care in the initial stage. Subsequently, I think we have improved our performance on that. And of course, having an age-related vaccine program has made a contribution to remediating some of the disadvantage that happened before. But the rush to get hospitals ready, I think, did result in the casualty of the long-term care homes at an early stage, and we were amongst the worst of those who reported deaths in long-term care homes. Taking the point about data quality that John was making, only a few countries, only the OECD countries really reported data on long-term care home deaths, and they calculated it in a whole series of different ways. So I think we did as bad as everyone else, perhaps not as bad as Canada, but as bad as everyone else in the initial stages, but we've done much better on age subsequently. Cathal, a few questions. Does the shared land border and CTA with UK make comparison most valid? Does the common travel area, does the measure of global connectivity in your model take the UK land border? Very good. Shouldn't you give more weight to poor outcomes which did not happen and the things Ireland did well, protecting jobs? And I've come to the bottom of this, Cal. Yeah, you've asked a lot of great questions. I'm not going to be able to answer all of these because we do have to stop in a couple of minutes. But do I think that connectivity with the UK and a common travel area is part of the problem? I think it is. I think there have been a leakage across from the UK. We have shut the borders in many ways, or controlled the borders a little bit more rigorous screening of UK folks coming to Ireland, and certainly the UK. We're screening Irish people moving into the UK, but the Delta variant in particular has exploded, as we know, in the UK, a very neoliberal, populist country, and we know that London is one of the most globally connected hubs on earth. So by definition, if we have hooked our wagon to global flows that connect in and through the UK, even though the common travel area has been managed, perhaps to some degree, the leakage has been significant, that we pick up some of the fallout from the UK for sure. But I think it would be wrong for us just to think that our numbers go up or down as a response to the efficacy of UK interventions and policies. There are indigenous drivers, I think, that we have to focus on first before looking to the UK for an explanation of our performance. Cal, that's a great question. So Hosie's a great question. I'm really sorry, I certainly haven't done justice to them all, but I'd really like to read them through. Connor, I think, has asked one, Jim's asked one as well. I think we've not got time, but I will take those up if that's okay offline. We do have to finish at 10, and we're a couple of minutes too. So can I thank everyone for coming along and for the questions. We've recorded this, so we have recorded the chat function too, so I will follow up with people, and I hope this gets us off to a good start for what I think is going to be a really exciting research week here in Maynooth. Thanks to Musie, thanks to Anne Hamilton Blank, and we'll see you all at other events as the week unfolds. Bye-bye.